Hello everyone. I'm Dr Hima Deepti Alla. I'm a consultant nephrologist at Arete Hospitals, Gachibowli. Today I'm here to talk to you about diabetic nephropathy. What is diabetic nephropathy? Diabetic nephropathy is a condition which causes long-term kidney disease in all patients with diabetes. Over 30% of diabetics have developed diabetic nephropathy at some point in their life. People with type 1 diabetes may be diagnosed up to 15 to 20 years after they develop diabetes with diabetic nephropathy, but type 2 diabetes patients may even present with diabetic nephropathy at the time of diagnosis itself. Who is at risk for developing diabetic nephropathy? Who should be careful? People who have a family history of kidney disease, who have long-standing diabetes, who have uncontrolled diabetes, who have coexisting hypertension, and if they have other medication like use of painkillers for a long duration, they are at risk for diabetic nephropathy. Unfortunately, diabetic nephropathy does not have symptoms at the onset itself. So what is the problem with diabetic nephropathy? How does it affect the kidney? Long-standing diabetes and uncontrolled diabetes or diabetes associated with hypertension, they develop problem in their blood vessels causing leakage of protein in urine. So this is not evident at the onset itself. It can happen insidiously, it can happen gradually, and by the time it is diagnosed, it could have been too late. What can you do to prevent it? So diabetes is a condition which might be genetic, it is multifactorial. But what can you do to prevent diabetic nephropathy? By controlling your blood sugars. Control your blood sugars, control your blood pressures, and have your regular screening tests with your nephrologist or your physician or your endocrinologist. So what happens in diabetic nephropathy is there is leakage of protein in urine. Patients usually present with symptoms such as swelling of feet, facial puffiness, or they can have reduced urine output or any burning sensation in urine. And a lot of my patients complain of increased frequency of urination, that is, there is disturbance in their sleep pattern. They may be waking up too many times to go to the bathroom in the night. If these are the symptoms presenting, then there can be a symptom. This is called polyuria. Occasionally, patients might present with worsening breathlessness or loss of appetite or any feeling of ill-being. This is even more worrisome because it means that there is progression to kidney failure. But again, I want to say the fact that it is not always that they present with the symptoms. It can be the diabetes might be affecting the kidney and worsening the condition even without symptoms. So what is my message to you people? That diabetes is a risk factor for kidney disease. So you have to keep monitoring your kidney status and its function from time to time. What is time to time? It could be you have to get your regular screening of your kidney function every year. What are the screening tests? Screening tests for diabetes include urine test. There is a test which detects urine protein loss. So when there is loss of protein in urine, there can be frothing, and without frothing also you can detect protein in urine. Regular BP checking is required every day if possible at home. If not possible, at least once a month or once in 2 months at your clinic close by. And you have also checked your GFR, which is glomerular filtration rate. It is the nature of your kidney, how much it is filtering the blood to remove the toxins. So to check the GFR, we do a blood test called serum creatinine. It is a reflection of the glomerular filtration rate. At any point when the kidney function starts deteriorating, GFR falls and the serum creatinine increases, and it might be associated with increased urine protein excretion. So these tests on a routine test might not be detected. So it is done as a part of routine screening all diabetics and at long-standing diabetics and people with hypertension also. So you have to check your blood pressure, blood sugars, check your urine protein loss, and you have to check the serum creatinine. At any point, if there is worsening of your vision also, it means that there is onset of diabetic retinopathy. In a similar way that the retina is affected, the kidney can also be affected because both are microvascular changes present in the small vessels in your body. It can happen in the heart, it can happen in the eye, it can happen in the kidney and in the peripheral vascular system also. So diabetics always have to be careful in monitoring their sugars and kidney function. So my take-home message is that all diabetics who have been having the disease for over 5 years or new onset diabetics should have regular screening of their kidney function along with the sugar control and BP control, and they have to meet the nephrologist so that they will guide you in this journey so as to prevent kidney failure. Thank you.